Ramon, if you had an infinite budget and infinite resources, what do you think would be the best for the city of Philadelphia to invest in? Is it more beds? Is it more outreach workers? Is it more, what is it? If you had to pick three things.
Three things.
Three things.
So definitely, I believe in boots on the ground. I believe in lived experience. So I would fund to have more engagement teams of certified recovery specialists and certified peer specialists, because engagement is a very important piece, and empathy and compassion is. Another one would be treatment. So treatment all the way around. So treatment is not only beds. And I want to really say that it's not about beds. Treatment all the way around the board. I believe treatment should be more person-centered instead of a cookie-cutter approach. Everybody is dealing with something differently. It could be cultural competency. But I believe it should be more person-centered. And third, we're talking about treatment, right? No,
Anything you want. Anything you think.
I believe in
the city
giving back to
should
the
invest
community. I believe in giving back to the community, helping the community get back into quality of life.
Good. Same question for Tim Lehman. Esperanza Hudson, and what you do.
Yeah, I think I would actually have a few of the same answers. I mean, I think big picture treatment, I mean, I feel like what we do in the medical community with medication-assisted treatment is just a tiny piece of a very big picture of treatment that's needed in terms of emotional supports, peer supports. I mean, just a lot of different levels of it. And I think it needs to be the whole combination. I mean, I think it needs to include beds, and I think some people really do need some periods and seasons of time in inpatient or extended rehab, but I think it needs to be then the ongoing linkage of transition out, like follow-up, and I think people on the ground. I mean, outreach workers, people in peers in recovery and so forth. I think it's sort of narrowed to three. I mean, I think like the whole prevention piece too is huge, and just how. I mean, obviously our whole education system, whole lots of like pieces are connected in terms of the things that need to work better in our city in order to create less of the gaps in care, less of the gaps. I mean, to break down the gaps in care and opportunities that cause. I think so many people feel both the desire to start to dabble in substances that then become gateway to much more problematic things, as well as
Hold that mic just. I've also, at least the little experience I've had, I'm a pediatrician, so I don't see a ton of this. I see that families deal with it, but longer treatment. Like, people don't realize how long it takes to rewire that brain, rewire those habits, and learn how to live a quote-unquote normal life again. Months, years, so longer ongoing therapy, treatment, intervention. I've also had mentioned to me. Leah, same question. Rock Ministries. What could Rock Ministries do? What can they use as they reach out to the community?
What could Rock Ministries use? I think the first thing that comes to my mind is even just the verse, "The harvest is plentiful, but the laborers are few." I think there's so much opportunity to do new things and grow and reach more people in the best way possible, but ultimately, it takes those willing to, give their time and stay committed and, yeah, I think just even what I was saying, just being that consistent presence, because, you know, trust can take a long time, especially for people who've been hurt or, you know, dealing with really difficult things, gaining trust, and it can take time. So I think, honestly, I would say, just from my perspective, willing soldiers, yeah.
Anybody who wants to volunteer, find her at the end. Okay, thanks. Some pre-admitted questions that folks sent in advance. I think the folks in the back have. Yeah, okay. So, people have many opinions about the idea of harm reduction, particularly with regard to long-term maintenance on methadone. But in some ways, isn't most of medicine harm reduction? For instance, if I start someone on blood pressure medication, I am decreasing potential harm from hypertension without necessarily curing their problem or eliminating the high blood pressure. Is this a fair comparison, and is this a helpful thing to think about when thinking about medical treatment for substance abuse disorders?
So I think harm reduction is always a good idea. At its very basic level, I mean, you know, it's sort of one of the foundations of what we commit to with medicine is we're going to reduce harm. Obviously, that has a whole lot of connotations. It means a lot of different things to a lot of different people. But I think sometimes we kind of pit this idea that we're pitting harm reduction against something else, and I think that's kind of an unhelpful thing a lot of times. I mean, I think we really do want to reduce harm. And so, I mean, I think some of these, this question was asked in the context of medication-assisted treatment. I mean, and I think, I guess my perspective is I think that medication-assisted treatment has a role. And I think that there's lots of people who have experienced help from it, and it's been a tool and a bridge to get many people out of crisis into places to be able to get other help and support that they need. I mean, I think, I think that the big picture things that we're all desiring in people's lives is going back to some of those very big picture pieces that I talked about connection and wholeness and health in every area of our lives. Sometimes I think there's a sense of like, well, if you still need a substance to be healthy, are you really healed? I think that's kind of a false distinction. Like, I don't think we think about that. We don't think about that way in diabetes. We don't think that way. I mean, you know, I take care of people in practice. I have family members that are pastors and preachers that have had their depression well controlled on antidepressants for all of their lives and careers and are effectively administrated and healthy and doing well in medicine that's helping to make that possible. I don't think that's any less healed or whole than somebody who's experienced that healing without medicine. And I don't think it's that way in recovery either. I mean, I think if people can get to the place that they don't need that anymore, that's great. I also don't think that's something we need to be holding out here as like, well, we're really both healthy and healthy, we don't need that anymore. I think it's kind of arbitrary.
So I just want to speak to the fact about, okay, harm reduction, medication-assisted treatment, right? So with harm reduction and medication-assisted treatment, and I'm going to use what you said about diabetes. Medicated-assisted treatment, I was on methadone for a year, and I was able to be in my daughter's life, right, when she was born because her mother had postpartum, did not want the child. So I thank God for medicated-assisted treatment because it allowed me to be there for the first year. But let me say this, it's not only the medicine. So when you take insulin, you have to change some behaviors, right? Some eating habits. So what happened to me was I was on medicated-assisted treatment, but never took care of my behaviors. And in harm reduction, we could continue to work on harm reduction and do the things of harm reduction. But if we don't take care of the behaviors, it'll never work. Okay? So I think that's...
So specifically now, let's say from harm reduction in general to supervised injection sites, the any opinions, research, data, anybody wants to contribute about what they think about supervised injection sites? Do they work? Do they not work? What do we think?
So I am here as a journalist, not here to, comment on, what I think about these sites, but I can tell you, what some of the different countries have done and what they've found to be successful or not. I have talked to officials of the Trump administration about this multiple times and pressed them about why they're so aggressively going up against the supervised injection site in Philadelphia. They don't feel that it's effective. They did go visit several sites in Canada to, see how they worked, and decided it wasn't something they wanted to endorse. They are very, very strongly pushing needle exchanges in different communities. And I mean, by very strongly, I mean they're literally on the ground saying, you have to do this, we have to stop the spread of HIV, etc. Portugal is one country that has seen a reduced number of deaths, reduced number of addictions. And part of what they had was, yes, a supervised injection site, but they also did a lot more. They invested a ton of funding into rehabilitation and treatment. They essentially decriminalized the drugs, but they didn't just, allow people to use everywhere. They put people in treatment directly. So, in that case, you don't have sort of an isolated program. You have other support to make sure that people are successful. And these sites aren't intended to, be, they're intended to sort of be there so that when people are ready to make a change, then they can easily do that. And I know that the site in Philadelphia is set to open next week, but I also know that there might be a court challenge. So we'll definitely be watching, what happens here and how successful it is. I have talked to Philadelphia's health official about this and why they're doing it, and he says we don't want it to be in isolation of everything else. It's one piece of several other measures that we're taking.
I think it's very interesting to look at this perhaps from a cultural perspective from the United States. And many times in the United States we do things incrementally, and small baby steps at a time. So I would just throw out there as a baby step to have clean needles provided, not the drug itself, but a safe, clean needle exchange perhaps, and look at the data on that and studies where that has been implemented and see if that has assisted in reducing the soft tissue infections, the Hep C, the HIV transfer, etc. And some of the, my argument for and against would be a focus on the other conditions that using needles cause. And I'm sure our physician can run through a list of those and how those have increased and decreased given the opioid crisis. So if you want to approach and study this issue, I would argue your point from that perspective, because that would address specifically the medical issue at hand, and not necessarily, but it would not take it into a situation where you're combating not in my backyard mentality. Okay, so when you focus on the soft tissue infections, the Hep C, the HIV, etc., from a medical perspective, in your argument, I think that is much more convincing to policymakers, clinicians, the general public, as opposed to all the other reasons why it might not be felt to be safe. That's just my personal opinion. It's neither here nor there. Here, you take for what it's worth. It's just what I found to be the most convincing argument to the various audiences and researchers that have studied the issue.
So you're saying, just to clarify here, so you're saying that the community should be interested, regardless of the drug involved, they should be interested in decreasing levels of Hep B, C, A
Exactly.
in their community.
Exactly, exactly. And I think that those are
That's
most,
good.
yeah, those are the most convincing, evidence-based arguments, pro and con. Okay? And I think that the data is where I think is where the focus should be. Again, personal opinion.
Anyone else want to comment on supervised injection sites? Can I say that's the number one question we got from several people in our audience? Any? Oh. Thank you, Mary.
What exactly happens at a supervised injection site?
I don't know if there's a one-size-fits-all answer to this, but I mean, I think probably like the most experience with this has been some of the sites in Vancouver, at least in a North American context. I mean, typically what has happened there is they have volunteer staff, in some cases hired medical staff on site, where people bring their own substances to use. If someone were to overdose on their own substance, then people would have Narcan on hand. It would be available to resuscitate them. That's at the very sort of micro level, but then there's also a lot of other pieces that those sites have typically incorporated, including pieces of helping provide social services to help make exit plans about what is your next step, are there other things you're thinking about, what else you're doing. It's generally paired with needle exchange and strategies to help people using clean needles, making clean needles available, so you're reducing hepatitis C and HIV transmission. You're hopefully taking the use of some of the substances off of the street in ways that help have less needles out of the neighborhood. You're many times in cases doing wound care for people who are shooting up, creating abscesses and skin infections, and actually treating those there. So in a lot of cases, there's a pretty broad piece of different layers of intervention that are happening there. At least that's some of the sites in Vancouver. I mean, as some of the reading into this, I mean, it's pretty interesting, at least some of the experience in Vancouver, is they've actually seen that of people that utilize the supervised injection sites were more likely to go into an extended period of treatment and recovery in the following year than cohorts in the same community who didn't use the treatment site. Which you would think is sort of backwards because you're thinking, well, the strategy, I think it's, sometimes we sort of paint this as like, well, we're just giving up and anticipating that people are going to keep using and we're trying to have them not die in our presence. And it's really a lot more than that. I mean, I think when you have people that are spending frequent amounts of time with people who are having some of that isolation contact is being dealt with and things like that. I mean, some of the outcomes of the studies in Vancouver actually showed that people that use the supervised injection sites were more likely to get into successful treatment and recovery than people who didn't. So I mean, I think that's kind of an interesting thing to think about. I think one of the hardest parts about this whole conversation is just that it's so incredibly emotionally charged because it's a lot more complicated, I think, than just the medical data. It's a lot more complicated, I think, even than just the not in my backyard kind of feeling, because it's one thing to have a not in my backyard feeling when you have the power and the ability to have it not happen in my backyard, and it's another thing to struggle with the feeling of not in my backyard when you're coming from a community that never has the power and ability to actually shape policy in the area. And so I think just kind of the emotional impact that it has, say, in a neighborhood like Kensington for neighbors and residents, in many cases, and I mean, obviously can't speak for, within Kensington, there is a huge range of perspectives in neighbors about whether they think this is a good idea or not. But I think it's really difficult in communities that historically have not had a lot of political power to feel that a policy is being brought there, that there's a sense that this same policy application would not happen elsewhere in the city. And we're seeing that a little bit right now, as I think there was a plan to open the site first in South Philadelphia, which about 24 hours later, lots of political power spoke into it, and that plan's off. I think it's an interesting question. A few weeks now, they decide to open a site in Kensington. Will there be the same political power and clout to say no to that? I'm not saying yes or no. I'm just saying these are the kinds of things that people on the ground, they're trying to sort this through, are experiencing. And so there's just a lot of complicated emotional reactions that's even separate from the medical data. If I was just looking at the medical data just by itself, I would say that the medical data trends towards there's some use to this as a potential strategy among many other strategies. But when you talk about how you actually implement this in a fair and just way in a city that has all the complex needs we have, I think that's a hard question.
And some of the articles that I read seem to emphasize because the staff is fairly regular, they get to know the people that come in often, and actually some strong therapeutic relationships develop between staff and folks that are using the supervised injection site. And so over time, they leverage those therapeutic relationships to get folks into treatment, and that's why it generally tends to be a bit more successful when you go into rehab that way. Any other comments?
I do want to touch quickly on the political side of this too, because I think we have to think of it in terms of, you know, how far the U.S. has come in terms of understanding, you know, different options that we might have for addiction treatment. I mean, the fact that a Republican administration is so strongly pushing needle exchanges is a huge turnaround for the party. And they kind of say, well, we want to make sure, because supervised injection sites are so controversial, they kind of want to get the country to that step at least of having needle exchanges because they think that it's an effective strategy. If you look at, I mean, our vice president, when he was governor of Indiana, pushed back against the needle exchanges, and now he's running an administration that's really strongly pushing them. So there has been an evolution here in the way that people think about addiction and how to treat it, and you know how they think about harm reduction. So I think that's just kind of worth acknowledging that you know things have changed.
I think our next question. Okay. Oh, right. So I think this must have been submitted as a text. What is a loving and effective way to help someone in the road or by the road who displays being high when you're walking or driving past? Okay.
So, as I said, I live in Kensington, born and raised. Part of the problem for so many years. Today I'm grateful to be part of the solution. So, and like I said, I had loved ones that are in the going through substance use disorder. And I treat everybody the same with love, empathy, and compassion. Because that's what we should do. That's someone's child, that's someone's mother, that's someone's father. I engage with a person if that person is not ready for treatment. I continue to engage and just talk to them. But I do not leave without giving that person some Narcan. And that's a way to show them love. I want you to stay alive. And I give them some Narcan. And I continue to stay consistent and trying to engage with a person. When I'm driving, and if I see somebody that's distraught or really is in trouble, I pull over and because that's just who I am. Because I was there. I was that person. So, and if somebody did save my life 3 times. So, I'm just paying it forward, and that's what I do.
Tim, do you want to review the rules on Narcan and how you get it? I think almost anybody can get it for free now.
Yeah,
Is that correct?
there's a standing order in Pennsylvania that actually you can basically go into a pharmacy and say, I want Narcan for myself. And your insurance is supposed to pay for it to you for then you to be able to carry it to use for anyone that you want. So you have to be able to work that through your insurance plan. I mean, there's obviously a whole lot of other community organizations that are on an ongoing basis providing different trainings in different places through the city and so forth to get it. But yeah, I mean, certainly if you're moving in communities where this is prevalent, I would highly encourage learning how to use Narcan. It's really simple, and carrying it. getting used to walking with it in my bag at this point.
So, also, at Community Bay off 801 Market Street, every third Wednesday of the month, they have a free Narcan training from 10 a.m. to 12 p.m. And it's free and open to the public. So it's every third Wednesday from 10 to 12 at 801 Market, and it's on the 7th floor. You're just walking, 10 to 12.
Follow up with Ramon. The question is, when you're talking to somebody that's high, can they hear? Are they listening? Are they in there? What is being that's why I can't figure out who's there. Can you reach them, or are they not there?
So possibly nothing. Just being honest. Possibly nothing they can hear. But in showing them that it's just a compassionate thing. One of the things about engagement is listening. It's not a lot of talking. It's listening. And I think that's the problem that we're having. We're not listening to people. We're not listening to our communities. You gotta listen to the person. Well, when somebody's out there suffering from substance use disorder or mental health challenge, right? They probably have no one that loves them. They feel like no one loves them at that moment, right? They've probably been through some type of trauma, because most of them have been through some type of trauma, right? And nobody's listening to them. So in just listening to them, that's showing empathy. And just listen to them. A lot of times when I engage with someone, I try to remember a lot of things. So the next time I speak to that person, I say, hey, how's your son doing? Or whatever he spoke to me. And that starts something, because they say, wow, that person listened to me. And that's being empathetic and compassionate. Again, these are people's children, these are people's moms, fathers. They're human beings, you know, and we just got to treat people with empathy and compassion.
Is there any, okay, whoops. All right, so, again, saying that there needs to be a holistic approach in addressing the opioid crisis. Do you know any organizations in Philadelphia that assist individuals with a history of addiction transition to a normal life, such as workforce development? Are there any resources, methadone clinics, Suboxone services that are Christian-run that folks would recommend? Other than, of course, Ms. Brown's house.
So I'll say one, and we've been working with them lately, and that's Rock Ministries. Rock Ministries right now has the same day pay program that helps individuals receive $50 to work a couple of hours a day. It goes through a lottery system through the city of Philadelphia and CLIP. And the Rock Ministries has a community outreach person that I work with a lot, Ramon Crespo. And we constantly are engaged with him. And try to follow up. So she could tell you more about Rock Ministries.
And Ramon was supposed to come tonight. Is he here? No, he may not be. I'm sorry? Oh, Pastor Buddy's here, yeah. Pastor Buddy's here. Raise your hand, Pastor Buddy.
He's trying to hide.
Okay, Leah?
So it's interesting. I think that you actually might be the better resource for this one, just because I personally work so much more with the children. I'm not as much involved with the addiction ministries, but we have many people here that if anyone has any questions specifically about where the Rock, usually sends people or recommendations, I can absolutely direct you to someone who knows for sure.
I see Tim reading the question. Do you have any comments?
I think it's really a pretty long list. I mean, I think Laura put together some of these, a few of these ministries.
We didn't get a ton of responses out of Esperanza, to be honest. They gave us a few names, but...
mean, a couple, if some of this is in the context of places to connect from a volunteer standpoint and things like that, there's an organization called The Table that's regularly providing meals to people in a way that's helping to try to engage people at the relational level and then also help think about next steps and so forth. One of the nurses at Esperanza, Miguel Ferria, volunteers there, and a few other people do too. The Salvation Army is running a drop-in center for women in the community that have been affected through the opiate crisis in a variety of ways. So that they have a lot of really effective services that they're providing. But those are just a sampling. I mean, there's a lot of different Christian and non-faith-based organizations that are doing good work.
There was a Salvation Army person that's, raise your hand. Okay, there we go. So, yes ma'am.
I'm not with the Salvation Army Drug and Alcohol Center. I'm with the Roxborough Court. We're connected with the center where my husband and I are able to go and to minister to people who are in our program.
And our program is Christian-based, and it's a 9-month program. It's a work study program. The difference is we don't, ours is total abstinence from, as you have talked about, other drugs being used to overcome the addiction. Ours is, we don't do that. And again, I can't really speak on behalf of the Drug and Alcohol Center because that's not a role I have, but I do have the opportunity to minister to people who are struggling and with addiction and overcoming it through the rehab center. And we do have the drop-in center as well. And I'm glad that I now have the mic because I have a question for Romaine. I'm new to the city of Philadelphia. This is the first city I've ever lived in. I live in rural Pennsylvania. And in the part of the city that I'm in, we aren't like Kensington where it's evident that there's addiction and sometimes there's that denial that there's a problem in our area. And I'm only here since July, and I can tell you that in that short amount of time, I've personally met people struggling with addiction, not through the recovery programs. But you had mentioned several programs that I'm so happy to learn about. But my question is the Community Wellness Engagement Team. Is that if there are parts of the city, maybe more rural, that we're not seeing the addiction the way that other parts of the city are, what is being done in those communities, or what can we bring to our communities to make people aware that addiction is there, but also to, as you say, engage? Because I want to be there. I want to be the front line, but I don't know how to do that and to make my community aware as well. Even my own congregation, make them aware. So could you talk more about those programs and how do we bring them to other parts of the city, or are they there and I just don't?
Okay. So the Community Wellness Engagement Unit, as I said, right now we're working in Councilmanic District 7. And within the next 60 days, we are going to start 3 more teams, and they are going to South Philadelphia Councilmanic District 1, Councilmanic District 5, Darrell Clark's, which is Strawberry Mansion, and Councilmanic District 8, which is Northwest Philadelphia, Cindy Bass's district. And again, let me say, we're not connected with council. I'm just saying that's the council districts, and we're looking to, within the next 2 years, to be in all the council districts. As engagement, every district is different. We've got our data through a scattergood report, which shows which districts need them the most, and that's how we're going. And again, each team has a behavioral health specialist, which knows how to navigate the system, access people to treatment. They have a CRS, which is a certified recovery specialist, and a certified peer specialist who is in recovery with mental health. And the team is not only, like I said, they're not only doing work and trying to engage people and get people into treatment, we also are doing work within the community and trying to connect with our providers in that district. We're also trying to run community focus groups and forums to educate families and communities about substance use disorder, mental health challenges, and trauma and Narcan. We try to bring different trainings into the communities. We want to collaborate with churches, with any type of CBO, community-based organization in that district. So we want to partner with you, and we want to be able to do this work together. I think we've seen a lot of work that community-based organizations are doing in silos. And I think things are better when you have strength in numbers. They're more powerful. And one community-based organization can be strong in one thing, and one faith-based church might be strong in another. So if we continue to work together, I think we can really, really do some great work. And one of the other things is, a lot of stuff is data-driven. One of the things I always tell the community is, you know, they have the data, but I have the names. I know the names. You know, they're not just a number. That person has a name. And they're not a person that people call addicts. They're a person that's suffering from a substance use disorder or a mental health challenge. Thank you.
So, can this be our final question? I'm looking at the people back. Okay, they're calling our texted questions. Where do you think the church needs to step up where policymakers may never be able to do so? What are practical things the congregation can be looking to do? Any at all? Any comment?
I can start, I guess. You know, one thing I hear from so many parents whose kids go through this is that, you know, if they're a member of the congregation, they often see, you know, the church come together to make meals for families when they're expecting new children or when someone goes to the hospital. But if they have a child who has an addiction, it's often even an adult child, they don't have that same level of support. For families who are going through this, I mean, so many of them drain all of their savings in order to get their children, and I say children, some of them might be adult children, but in and out of rehab facilities. Many of them don't work. And so they drain all of their resources, and their children cycle through this and still die at the end of it. And you know, treat people who are in your congregation going through this as if, you know, they were people going through anything else that was similar medical condition. It is really, really hard. They don't have the support, and they don't really feel like they have too many people to turn to, and a lot of them lose the people they love at the end of it, despite all of the efforts they put in.
Yeah, I would just say that this is a great opportunity, like we're doing right now. I mean, we're talking about it, you know, supported by Tent and some other churches and so forth. And I think it goes a long way to destigmatize the battle and the struggle that folks have. And I would think that there must be a hesitancy due to the apparent shame that one must feel by coming forward and saying that they are struggling. And that, of all the places in the healthcare field, the church should be the last place that shame should be felt in this area. You know, it's a lifelong struggle. It's a disease that the person will be struggling on forever. And it's just a great opportunity to be all hands on deck on this crisis. You know, this is like nothing we've ever seen before, and we should pull out all the stops and get all hands committed to fighting it with every resource we have.
Anyone else, and also any last comments that people feel like they...
Great, thank you. I had actually sent in a couple of questions that I don't think we're going to get to, but what I would really like to know is, I've been to a lot of these focus group sessions, and we've got a lot of people in the room, and I don't see a lot of guidance and leadership where people are being given the next steps. And the one thing that I would like to know is, substance abuse meetings in all of these substance abuse communities is that a lot of programs and a lot of resources are going into the community. They're never ever going to the heart of the problem or the root of the problem, and they're never really going to it's a heart issue, it's an emotional issue. When you are changing habits and behaviors, I really love what Ramon said about behaviors. You can give people medications, you can send them to therapy, you can talk to them, but the real root issue that I'm hearing in all of the recovery groups that I have been attending is that it is a spiritual, it is an emotional issue. People, that needs to be addressed too as well. I read an article about how you need 4 hugs a day just to survive. And this is exactly what I see in the drug community too as well, is that it's a heart issue. It's even in my own life, when I've gotten mad at God and been upset with Him and turned to destructive habits, it was a heart issue. And at the moment that I went and got right with God and went back to church and started going to Bible studies and reading the Word and praying, it took care of itself. I was God changed my behaviors. And so that's really what I was hoping to kind of hear tonight is what is being done to what is being done to really go to the root of the problem so that this is not moving from community to community. How are we going to unite the communities to be able to work together so that this issue we can get to the root cause of the issue for finally once and for all?
Big question. Long-term question.
So one of the things that I always talk about is the crisis that we're having is just a symptom of what's going on. Economic issues, our schools being closed. The root of that problem is we're having children growing up without fathers that are incarcerated, or mothers that are incarcerated, or parents that are in substance use, or grandparents raising children. These are all of the root causes that is causing a lot of this crisis that's going on, because it is a crisis. And again, we have school closings, we have our schools with asbestos. What are we doing to deal with those root causes that are causing a lot of these issues and a lot of these crises? And I truly believe that these are some of the things that need to be looked at while we're looking at trying to help people into treatment and give them the help that they need. And again, I truly believe, and I'm big on this, is our faith-based churches need to step up. Because when a person is in crisis, the first person that they usually go to is a pastor or a priest. So I think we need to also arm our faith-based churches, and when I say arm, fund them, give them the necessary resources that they may need to deal with this crisis.
I think my response to that last question would actually be sort of the same answer that I would have given to the question before it, in terms of where does the church need to step up. And I really think, the church needs to be able to be effective ministers of the whole breadth of the good news in all of the places that it's needed. And I know that's like a really big way to frame it, but I think the church, for one, needs to be in the places that people are struggling with these things. So there are churches that are engaging these things, and a lot of times they're in the neighborhoods, on the ground, on the corner where this is happening, and they are having people coming in and out of their doors, and they are responding to this. So I think sometimes a sense of like I think if we're in a church where we're like, how can I help? Because it seems like a ways away. I think something we have to ask is, why are we a ways away from where this is going on? So I think that's that But then I also think we have to be like, how good a job are we doing at being a church that's creating meaningful transformation in all of our lives? Am I experiencing spiritual transformation, things that constantly changing in my life? Is the person who sits next to me, is my wife, are my kids, are the people in the pew, and are we the kind of church that that's happening all of the time? And then are we a church where we have habits of those things happening, that's located, that's sitting ourselves down in the places in our cities where these things are going on? And I think when the church starts wrestling with that, then we're going to be on the ground in the places where we're going to be rubbing shoulders, living Christian community that results in personal transformation with people who are struggling in the areas of all kinds of things, including addiction. And so, I mean, I think that, some of the things, when there's the sense that these things are moving from place to place, I think ultimately, like the work of the church needs to be reproducing discipleship communities that all of our lives are changing all of the time in all of the neighborhoods of our city. And I think when we're doing that effectively, then a lot of these things, begin to take care of themselves. I mean, certainly from when I was telling stories about my patients, what my patients, the two stories I told, need on top of, a once-a-week ability to sit down with people in a recovery group is they need a Christian community that they can live their life in the other 6 or 7 days of the week too, and obviously all of those layers. So I think we as the church need to, I think we need to continue to understand that when we're talking about the whole picture of health, that I think we continually need to be not seeing the spiritual, the medical, the social, the emotional as like sort of in competition with each other, but all pieces that need to be healthy together. But I think we also, I certainly speak as one who spends a lot of my life operating in that model, certainly recognize that the kinds of healing that God desires to bring people in communities needs to touch areas that go way beyond what the medical model is being or has the capability of touching. I think that's true kind of for every different layer of this, kind of all pieces together.
Okay, so I think it's time we should wrap up. We're almost at 9. Is there any final comments from anybody on the panel? Something that they really they had a burning desire to say but didn't get a chance to say? Yes, ma'am.
This will be quick. But when you were saying about the root of the problem, I was thinking about that, and because ultimately the root of any problem that we're dealing with is it's sin and it's brokenness. We live in a broken world, and sin until Christ comes back will never be fixed. So from our end, I think exactly what you were saying, not, medical against spiritual or medical against political, but who has God put in our lives? Do we have someone we know who struggles with addiction? Do we have a community around us that struggles with addiction? And how can we as ambassadors and followers of Christ most effectively love them with our own giftings? Are we a medical professional? Are we a member of the community? Are we a journalist? How can we influence our communities? Maybe not the whole world, maybe we're not going to ever fix the entire city, but we can give them the hope that one day, our hope ultimately is the hope of Christ, and that whereas we're finite, we're people, we're human, we don't have all the answers, but Christ does. So I think ultimately it's like using our giftings to the best of our abilities to most effectively help the people that God has placed in front of us.
Amen. We should end on that.